Hello, good morning, good afternoon, good evening to our viewers. We welcome you on Matters of Life. Here we educate ourselves, we learn, and we teach ourselves. And today we have an interesting topic. First of all, my name is Mary Linda Tediku, and I'm your host for today. Today our topic is blood pressure. We're going to treat on blood pressure, which we know is, let's say maybe 70% of people have it. It's becoming an issue. And today we have one of our sisters here who is going to, go into it a bit and teach us what to do and, how we can know we have blood pressure and other things. So first of all, I will welcome Mrs. Sandra Osei in our midst. We are blessed to have her in our midst tonight. And we want to, first of all, give her the opportunity to introduce herself, what he does, and before we move on. Please, Mami, so please.
Okay, like you said, my name is Sandra Say. I'm a general nurse. I work in one of the general hospitals here in Telford on a surgical ward.
Right.
So yeah, that's about it.
Right. Yeah. And how long have you been working?
I've been a nurse, I think, for 16 years now.
Wow.
Yeah.
Wow. Interesting.
Yeah.
God bless you for being here. We welcome you in our midst tonight. Yeah.
Thank you.
And so, as I said, we want to discuss about high blood pressure, which is hypertension.
Yeah.
And when we say hypertension or high blood pressure, what is it? What is high blood pressure?
Okay. Hypertension is basically the pressure in your blood vessels when it's high. So it's hypertension. It's two words. So hyper means high, and then tension is the pressure or high. So yeah, so hypertension. I'm sure sometimes we say, "Oh, this child is too hyper."
Yeah.
So the child is acting too high, too abnormally.
Right.
So that's basically when the pressures in your blood vessels is unusually high. That's what we call hypertension. And when that happens, what it's doing to your blood, basically the heart pumps blood through your blood vessels to the other parts of your body, kidney, eye, brain, all sorts. And when the pressures in your heart, when your blood pressure is high, what happens is the heart is overworking and the vessels cannot really contain it. It's like when you've got water hose, it becomes too high, the power becomes too high, that it can't really go through properly because hypertension is caused the vessels to occlude. Sometimes it gets narrow. Sometimes we get fat deposits and stuff in there. So it doesn't work as well as it should, and therefore it affects a lot of parts of your body, like your kidneys, your eye, your brain, and things like that. So basically, that's what hypertension does to you.
Thank you so much. And how do you diagnose blood pressure?
Okay. Blood pressure, I'm sure we've all heard that it's called the silent killer because the diagnosis, you can only diagnose blood pressure when you check the person's blood pressure. You can't just look at somebody and say, "Oh, you've got blood pressure," unless you put a blood pressure cuff and monitor and measure. So the figures are usually, they expect the blood pressure to be any maybe 120 to 130 systolic. That's the top one. That they think is a good blood pressure, up to like 85 diastolic. So anywhere 120, 85, that is good. 111 to 120, 125 over maybe 65, whatever, that one is deemed as blood pressure. There is one we call the pre-hypertensive stages. That's when your blood pressure is anywhere, the systolics are about 130 to 139 systolic. That's the people that we call the pre-hypertensive group. They are not really hypertensive, but they are getting there. So those people with a bit of dietary modification, lifestyle modification and things, then it can be corrected. And then we also have the secondary hypertension, which we normally usually get from problems like maybe you've got kidney disease. Sometimes we even get it from pregnancy. So the secondary hypertension is when people actually become hypertensive because of some medication or because of some condition, sometimes renovascular problems that causes them to have hypertension. And I don't think I even mentioned the primary hypertension, which is the first one, and which is the one that a lot of people have. The primary hypertension, what we also call the essential hypertension, is when people are sometimes age, and people who are predisposed to it because of race. We know that a lot of black people, Asians, Caribbeans, Africans, prone to have hypertension. Don't ask me why, but usually I think it's because our diets are also very similar. Yeah, and sometimes our lifestyle and obesity causes it, and smoking and things like that. So those groups, we all fall into the primary hypertension group. So I think that's about it.
So where is the borderline? You know, what number when you check your blood pressure? I hear you are on borderline, you know, which you have to be careful.
Yeah, the borderline is what we call the pre-hypertensive. Yeah.
Right.
So the borderline is anything from 130 to 139 that you are hypertensive. You're getting there. Yeah. So according to NHS, anything 140 over 92, then you are actually hypertensive. But it's not just one reading. Before you be diagnosed as hypertensive, and because sometimes there's something we call white coat syndrome or white coat hypertension. Somebody can come to clinic, and because they know they are going to have their blood pressure taken already, they are stressed out, and they get anxious, and then their blood pressure goes sky high. So studies suggest that the blood pressures that are usually taken at home are the best ones. So now, before your GP will diagnose you as being hypertensive, they will usually ask you to be taking your blood pressures yourself at home for maybe a week or two, and then you take it to them, and then they will have an average and see whether you're actually hypertensive or not. They usually like it in a relaxed condition. Maybe you wake up in the morning, you do, and maybe last thing at night, just so that you're not under any stressful condition. Nothing is actually getting your blood pressure to be high at that moment, just so they can diagnose. So before you can be diagnosed as hypertensive, you have to have a blood pressure of a reading of 140 or above on 2 or more consecutive occasions, and not the same day. Maybe not today, you have it today, and maybe you have it tomorrow, a few days, and if they are the same, then they can actually say that you are hypertensive.
Right, okay, thank you. I think you've talked a bit about my next question, but I don't know if you can throw more light. What is the main cause? I think you said raise our dietary and other, you know. Is there any main cause apart from, you know, if you are pregnant or the other ones that
the secondary hypertension? Causes of hypertension is usually age will bring it, because as we age, we're going to take in salt, a lot of salt. So age brings it. I'm sure with age, the blood arteries, the blood vessels begin to narrow and all those things. So it can cause hypertension. Lifestyle, big thing. If you speak to a diabetic nurse, they will talk about lifestyle. Speak to a renal nurse, they will talk about lifestyle. Lifestyle is a big thing. If you are hypertensive and I eat your food and I'm not a hypertensive person, I should be able to say that there is no salt in your food. You know, so if I'm enjoying your food as someone who has not been diagnosed with hypertension, then I think you're not doing something right.
Okay.
You know, yeah. So our lifestyle, the way we eat, sedentary lifestyle, you know, not exercising, smoking, drinking, all these things can really push our blood pressures up. Like people who are genetically predisposed, let's say your mom was diagnosed with hypertension, your dad, maybe grandmom had it, granddad had it, there is a higher percentage of you also having hypertension.
Right.
So yeah.
Okay, so that can also be genetic.
Genetic, yeah.
Yeah, something. Thank you so much for that. Yeah. And so, what are the symptoms of high blood pressure?
Okay. Symptoms. I think I've already mentioned that. That's why we call it silent killer, because it doesn't actually have symptoms. What happens is people that get diagnosed with blood pressures, they usually present with the side effects of hypertension. So somebody will come into hospital, into a clinic and say, oh, I woke up this morning feeling really dizzy, I've got a headache, this. And then you go on to find that, oh, okay, this person was actually having headache, it could be dizziness, some people even bleed from their nose because of hypertension, because of high blood pressure. Okay. So basically, it doesn't
have any symptoms,
nobody can look at you and say, oh, you've got hypertension. But a lot of people will come in with their side effects. So by the time they come in, it's already giving them some side effects before you can actually even diagnose it. So I think the best thing to know that you are hypertensive is to get your blood pressure checked.
Okay. So is it good to check at what age can you start checking your blood pressure at home, to maybe know that I have it on, is there a certain age that, everybody can check it, or you have to wait till you get it before you start checking it?
You would know that you have it until you check it. I think in England alone, about 11.2 people from the age of 16 upwards are diagnosed with hypertension. So I think once you clock, because sodium, which is salt, which causes hypertension, the main one of the main factors of that causes hypertension is in everything that we have. The canned foods, the crisps, all these preservatives is most of them sodium, high in sodium. So I think once you clock 16, 18, 20, if you can do even if you're in your teens, maybe once every 3 months or so, but once you clock the 40s, maybe every 2 weeks, every month, once a month, I think it's good. It's good to check.
It yourself. Yeah. Thank you so much for that. Thank you so much. How can hypertension be, prevented?
I think we've already touched on them. Lifestyle. You know that you've got what we call familial hypertension. It runs in your family or hereditary or family history. So you start early because these things don't happen overnight. They take time. So once you know, grandmom had it, mommy had it, you start early. Reduce salt intake. You take, apparently studies suggest that foods that are rich in potassium can actually help counteract the side effects of the sodium. So food like spinach, banana, which are high in potassium, can help reduce hypertension as well. Lifestyle modifications like not smoking, not drinking. Thank God that there is studies in America to suggest that people who are Christians tend to live a lot longer and happy lives. And it all boils down to the fact that we know that certainly our bodies are the temple of God, and then we don't do certain things. So that study suggests that Christians tend to live happily and they tend to live longer. So it's just cutting all these things out, smoking, high salt intake, which is everywhere in our cubes. Some people will go to a restaurant, they have the chips there before they even taste it, because the salt is already there. They just sprinkle it before they even taste it, because salt is there. Why not? It's there to be sprinkled, and then we do that. So if we can cut down all these things, then we stand a higher chance of not having hypertension.
So even if you don't have it, as you have mentioned, the cause, things that, even if you are not diagnosed, it's better that you are careful those things, salt and other things, try to exercise and other, that lifestyle, before you get into
it.
As you're saying, a high number of people are having this hypertension.
A lot of people, and it suggests that even half of the people with hypertension don't know that they have it.
That's the risk.
The risk with hypertension is it hasn't got any symptoms. So a lot of people with hypertension don't know that they have it. So a lot of people pass away and I was talking to her last night. She was fine, and she went. She said she had a headache. She went to bed and she didn't wake up. The likelihood of it being hypertension is very high.
And even leads to stroke.
A lot of
not knowing, that you have the hypertension.
Yes. When the sorry, I didn't able to pause. Okay. When it affects the vessels going to your brain, you get strokes. When it affects vessels going to your heart, you're able to get heart failure, because sometimes the heart struggles to pump and then it enlarges, and that's when we get heart failures. And then we can also get what we call myocardial infarctions, which is heart attacks. When it affects the vessels going to your eyes, it causes blindness. So a whole lot. It's like a domino effect. It affects one organ, and then the other organ affects, and then it carries on like that.
Thank you so much. I think we'll go on a commercial break and then we'll be back. Audience, we are going for a commercial break. We'll be back. Hello, welcome back. Today we are treating blood pressure, and we have our sister Sandra Mose here, and I think we've asked a number of questions and we want to continue from where we left it. Now my next question is, what are the risks of untreated high blood pressure? If you don't treat it, what are the risks? What happens?
I think we've kind of touched on it already, because if you have
already diagnosed,
yes,
and you are not treating, maybe you are not taking your medication, you are not, you're doing that. What happened?
So when it's not treated, that is when it results to strokes and heart attacks, blindness, and all that. So the only thing to stop hypertension, hypertension is like a chronic condition. It stays with you forever. So what happens is you take your medication that you've been given by your GP, or you reduce things that causes the hypertension or that makes it worse, especially when you've been diagnosed. It doesn't go overnight. I don't even think it goes away. It's a chronic condition. So to manage it is to the things that we've already mentioned, the exercises, taking your medication as prescribed by your general practitioner or your doctor or your consultant, and lifestyle. If you're hypertensive, I don't expect you to go to McDonald's and add salt to the your fries, which is already got salt in, because the fries has got salt, the ketchup has got salt as a preservative. Almost everything that you take there has got salt, so don't you expect to add more to it. So just lifestyle, just like you haven't got it.
Right.
Your lifestyle, taking your medication, exercising. I think that's all I can say.
So if you have BP, or you don't need to add salt at all to your food when you're preparing.
No.
Just amount of
moderation. Moderation. I think when we were growing up in Ghana, we saw a lot of people who were not allowed to eat salt. Like I said, I've been a nurse for all these years, and I work on medical wards. I've worked on medical wards, a lot of specialities. I've not once heard that this lady is not allowed to eat salt. But it's just moderation. Like I said, if you're hypertensive and I'm not hypertensive, I eat your food, I should be able to tell the difference. Because I'm not, so maybe I've got a little bit of
Yeah,
freedom.
yeah.
But if I'm really enjoying your food, like, ooh, then maybe there might be something wrong, unless
Right.
that I know that I've got family history of it and I'm being careful.
Right.
You're allowed to use salt, but just minimize it.
Minimize it.
Yeah.
All right. Thank you so much. Yeah. So, what are the treatment options apart from medication? Is there any treatments that one can?
The treatment option is medication. Yeah, and lifestyle and exercise. Yeah, that's the only treatment option for hypertension, as far as I'm concerned. I don't know if there are any other treatment options.
Okay. And this is not here, but I just want to ask, adding like medication that has been prescribed to you by your doctor, and maybe you are adding what should I say? Maybe adding like maybe you buy a medication from Ghana,
Is it the herbal
herbal medication, and is it right to do that?
Okay, I wouldn't say yes or no. Because you might be taking some medication that is helping lower your blood pressure. But the problem with these herbal medications, we don't normally know the compositions of it. Before we take these medications that are prescribed by the doctors, they've gone through clinical trials and things, and we know them. But if you having some medication from Ghana, sometimes we don't know the composition, and sometimes they can even contraindicate to the medication that you're already having. Sometimes you can't take this medication and that medication at the same time. And sometimes too, they might even limit the absorption of the medication that you already taken. They might not help that medication to work properly. Also, because we don't know the composition of that drug, they might even be causing injury to other organs in your body that you might not be aware of. Now we hear of a lot of renal conditions, in Ghana or even among the black people, because I think it's because of all these Chinese things and medications and that we are mixing that we are not aware of. Yeah, so I wouldn't advise that you mix any herbal medication with the medication that you've been prescribed by your GP, unless you know the active ingredients in that medication, and then you've asked your GP and it's fine and there is no contraindications and your GP is okay with that.
Right. Thank you so much for that. Yeah. So how often should blood pressure be monitored? How often?
Okay. If you're hypertensive and you're on blood pressure medication, I think it's advised that you always take your blood pressure before you check your blood pressure before you take your medication. Because especially sometimes you are on more than one medication. Sometimes you might have to omit some of them because maybe this morning you woke up and your blood pressure is like 110 systolic. You don't want to get it lower than it is. So sometimes the GPs advise that you check your blood pressure if you can every morning before you actually take your blood pressure medication.
Right.
Yeah, or few times in a week. Definitely, if you're hypertensive. Yes.
Okay. I think there's had been few arguments about when to take it. Some people say it's good to take it in the morning. Some people, others say it's good to take it in the night because you are going to. Can you enlighten us a bit about that?
I don't think there's any specific time, any good time to take it. But what needs to be done is when you're relaxed. You because somebody can wake up from having a nightmare. You think, oh, it's early morning, but the person didn't wake up right. Sometimes you wake up startled. Your heart is pounding. Your blood pressure is going to be high. So you just have to check what condition you find yourself. Are you relaxed? Sometimes your child can even come, mommy, wake up. You wake up. Or you don't even know where you are, so you're startled. So I don't think that's the best time. So checking your blood pressure is up to you, totally up to you. Whatever time you think is best, whatever time you feel relaxed, you don't feel stressed, you feel like, this is a good time to check it. But say you're taking your medication in the morning, then it's best to take it, check your blood pressure before you take the medication if you feel relaxed. Or if you've had a bad news or you don't feel, just sit relaxed few minutes and then take your blood pressure and take your medication.
Thank you. Thank you so much. And in terms of the time, I mean, can one take, today I take it in the morning, tomorrow I take it in the afternoon, the next day I decide to take it in the, is it good, or it has to be a consistent, maybe if I'm taking it in the morning, it has to be every morning. If I'm taking it in the afternoon, it has to be every afternoon. If I'm taking it in the evening, does it have to be that, or you can decide to take it any time and any,
Yeah. Medication tends to work better if you're taking them during a particular time. Because let's say you are on one medication, you take it at 6 o'clock in the morning. If the following day you're taking it at 10 o'clock, you've left it too long. So it's always good to take it at a particular time. But say today you forgot to take it in the morning and you take it in the evening, it's not going to hurt. But I think it works better if you have a particular time of taking your medication. Some people take all their medication in the morning. Some people are on few, so they have to space it out within the day. Some people are on what we call TDS, 3 times a day medication, morning, afternoon, evening. So that one is also there. But if you are prescribed just one medication or maybe a few, but you can take in the morning, then it's best to take it at a particular time. Sometimes after breakfast, you take it. That's what you do. And it also helps you to remember.
Right.
Yeah,
Okay.
helps you to remember to take it.
Yeah. Does blood pressure medication have side effects? Which I know every medication, have side effects. Do you know some of the side effects of, the blood pressure medication?
Yes. The blood pressure medication, like any other medication, even paracetamol, like you've rightly said, have side effects. Like blood pressure medication like Ramapril, Depril, and they usually cause cough in people. A lot of people, have coughs with it. Studies have suggested that most of them also cause diarrhea. Some of them cause drowsiness, because some of them can also drop your blood pressure, which can cause drowsiness and things. So there are a lot of side effects. Some people, especially in our African men, also tend to think that some of the blood pressure medication causes erectile dysfunction, which when I was reading about some of them, yes, I did find that, it mentions it, but then I spoke to a doctor friend and she says it's not actually true. So I think it's actually the side effects of having high blood pressure that causes them, but then they seem to think that is is the medication that causes it. So there are so many side effects, but different, and even then the cough and things is usually apparently in certain group of people. So it's not everyone who have cough with the Ramaprils and things like that. So yes, but once you start taking any medication and you find that you're becoming too drowsy, the cough, you've got a cough lasting for so just go back to your doctor.
Then to reassess.
For reassessment, yes.
Thank you so much for that. Thank you so much for that. So, I want to know, I've heard people saying, caffeine, does caffeine increases high blood pressure?
Yeah. Yes.
And it does.
Yes, it does.
Nice a bit about that.
Because caffeine, because even when you're pregnant, the guidelines say that you shouldn't take a lot of coffee. Caffeine tends to let the blood, the heart work faster. A lot of caffeine causes what we call, it makes the the heart races faster,
Right.
it goes faster. So already you've got hypertension, the heart is already struggling, because of hypertension, and then you're also adding coffee to it. So the heart is going to have to work double time.
Okay.
The heart is also having to work double time. So like everything, caffeine is not a no-no, because caffeine make a lot of people tachycardia, which is your heart, racing, boom, 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 boom. Your heart rate goes high. So in pregnancy, it says 200 milligrams is accepted, because obviously they don't want too much, but pregnant too much. And I would say that maybe for hypertensives as well, the same. You don't have to let the heart work over time, because the vessels are already possibly narrowed because of hypertension. They've gotten narrow, and so the heart is working over time to try to push blood through to the other vessels, to the other parts of your body, and you're also making it work over time. That's why they advise that it's not good to take caffeine, because caffeine, I know a lot of people who have tachycardia after having caffeine.
Thank you so much for that. Thank you so much for that. I think we are bringing it to a close, but as we said from the beginning, it has become a problem, which you did mention that the number of people is in 99 points. Number of people having a blood pressure, these days it has become a norm,
Yeah.
And so as we are bringing it to a close, how can you advise us, the audience? Is there things, if you talk about a lot of things, lifestyle and other things, is there anything you want to advise us on, especially those who have already been diagnosed with blood pressure, and those who haven't, how they can, can do well to prevent themselves from, getting blood pressure, and,
Okay.
So it's just a round-up, something to finish with, a few advice before we bring everything to an end.
Okay. Those who have not been diagnosed with blood pressure, keep checking your blood pressure. Not say, every day you're checking your blood pressure. No, it's going to make you anxious. It's not good. So maybe once a week, if you're not diagnosed with it, keep checking. I think last week or the week before, we had a program here, and ChipNet UK set their table at the back. And then after the program, we were serving porridge and stuff. I was there serving the porridge, the blood pressure machine and everything. Everybody came, took their cocoa and things and left. I think I only saw one person checking their blood pressure. Let's get it checked, especially when we have the opportunity to. We can all go to Boots, buy it, it's at home, and then you check it once in a while. And also when you feel like, I've got this headache, it's too much, I feel dizzy, just check your blood pressure if you can, if you've got the machine. I think it's about £20 in Boots. And also lifestyle modifications, exercise, eating the right low-fat diet, things that will help the body, sedentary lifestyle. You don't even have to go to the gym and stand on. No, we have to avoid sedentary lifestyle. Some people, we go to work, we sit all day, we come home, we sit, not even to go for a walk in our area, in our vicinity, just a stroll, something that will not make you too immobile for too long, just to get the heart to work a bit, And if you are also hypertensive, all I can say is take your prescribed medication. And by saying that, I also want to sound this warning that, Mr. A does not go to Mr. B to say that, I'm a hypertensive and I woke up not feeling well, but I can't find my medication. Can I have some of yours?
Wow.
No, we don't, because before the doctor would prescribe your medication, they will look at your comorbidities, what other conditions that you've got. So if I've got like renal impairment, I've got other conditions, my medication will be different from yours. Yeah, so we don't do that. We don't go to, Mr. A does not go to Mr. B to borrow medication. So yeah, if you're hypertensive, take your medication, keep exercising, good diet, diet high in potassium, and then low in sodium, and then hopefully, yeah, sometimes, yeah, because some of these courses we call the reversible courses. You know, sometimes we can reverse some of them, even though we say it's a chronic condition. I've seen people who have exercised, taking care of their diet, and now they don't have to take their medication.
That's right. Yeah. First, I think that scare people the most. That is chronic. Once you get on the medication, you're not coming back. You know.
Yeah.
It scare people even to go on the medication because they don't want to take it for life. You know. Yeah. But at least it's good that you know people who was taking the medication and now with exercise and good diet have been able to come on it.
Yeah.
So you don't go and take yourself off the medication yourself.
No, exactly.
It has to be done by your doctor. Assessment
yes,
and
yes.
a doctor to tell you that you don't have to
need
take
your medication.
Yeah. Thank you so much for the insight, Mommy. We are so blessed to have you. We are so grateful to have you.
You're
Thank you
welcome.
so much
You're
for
welcome.
the enlightenment. And beloved, as our Mommy said, blood pressure has become something, a problem, and we believe that you have learned a lot tonight, and you're going to take care of yourself. If you're on it already, if you are, a hypertensive patient, please take your medication. And if you are not on it as well, try and live your lifestyle as well, properly. Take a good diet, exercise, so that you don't become a hypertensive patient. So we just want to advise you, take care of yourself, and I believe everything will be well. In Jesus' name, amen.
Amen.
Mommy, thank you so much for coming.
You're welcome.
Viewers, we thank you so much for watching us tonight. Please share it with others if you are blessed, and let them also be blessed. Share, comment, and we will see you on our next episode. God bless you for watching.